Hello and good morning. Today I'm going to talk to you about a very important MRCOG Part 3 station. And the topic for this is abnormal smear test and the management of this, especially in the pregnancy. Now, those of you who have done colposcopy will know that the management of this purely lies mostly with the consultants. So it is expert level of management. Most of your nurse colposcopists will refuse to see these patients, and they do land up in consultant clinics. So the management is quite specific to the patient in front of you and how worried you are. But there is some basic guidelines that we could look at so that if you did get a question in your MRCOG Part 3, then you would be able to answer this with absolutely no difficulty. Okay, so some of the smear results that you are likely to be asked about is mild dyskaryosis, borderline changes in squamous cells, moderate to high-grade dyskaryosis on your smear test. Okay, so how do you manage these patients? Now, patients that you think have got high-grade disease, so when you do examine them with in colposcopy, and you think they've got changes that are in keeping with high-grade dyskaryosis, so at least CIN2 or 3, you would want to do a colposcopy for these patients in early pregnancy and late second trimester. Now, if you did continue to find changes on their colposcopy, then you definitely want to follow up these patients postpartum as well, at least 3 months post-delivery. The reason being to allow the pregnancy-related hormonal changes to completely reverse before you can see the patient in clinic, and if treatment was required, to be able to offer them there and then. Now, patients who've got invasive disease, now patients who you think have got CGIN or actually cervical cancer will need a biopsy even in early pregnancy or second trimester. Now, the biopsy in pregnancy is not done with the help of punch biopsy forceps. The reason being that does not give us enough tissue for it to be analyzed because of the hormonal changes in the pregnancy. So the biopsy is actually obtained with a shallow loop. Now, as you can imagine, the cervix in pregnancy is very vascular, and if you were to do a loop, you have to be prepared to be able to manage hemorrhage, which is why these cases are left with experts in order for the management to be decided. So you'd only biopsy patients you think have actually are very high risk of cervical cancer or invasive disease, for example, CGIN. Otherwise, you try and follow up most patients. So if you've done a colposcopy in early pregnancy, then you'd repeat it in late second trimester, and then you try and repeat one postpartum, and if required, either do a biopsy or treatment. Now, the patients you think have got low-grade disease, so for example, CIN1 or less, you try and leave those patients again for a bit longer, so they could either just have 3 months post-delivery follow-up or just a yearly follow-up like like other patients who are not pregnant would if they had CIN1. I hope this helps you to kind of create this framework of management of abnormal smears in order for you to be able to answer exam questions. Now, if for whatever reason this wasn't clear enough, let me know and I can make a more detailed video as well. But I hope this was useful for you. Thank thank you so much for listening. I hope your part two has gone really well, and your upcoming part three exam will also be good. I do offer an RCOG part three course in order for you to prepare well for your exam. So if by any means you would like to access it, then please leave a comment below and I can get in touch. Alternately, if you find out in the exam section of this channel, you'd be able to find the link to the MRCOG Part 3 course where I offer one-to-one stations where you go through a timed station and we look at and I give you feedback as to how you've performed straight away on the day, so you're able to improve and take the feedback on board. It's a one-to-one course, so there's no other candidates, which means that I'm able to give you my full undivided attention. And if you think this would really benefit you, then please do access the course.